Kimberly Felix 40 served as a lab technician at the General Hospital, and Rosie Roxy Batiste 48 worked at the Mount Gay Mental Hospital. Dr. Martin tells GBN that it was a shock to the fraternity when the news broke.
Well, on hearing the news last night, the very first thing through my mind was one of disbelief, which is normally how humans react to bad news or getting bad news, and learning more so that people from our fraternity was unfortunately involved made it even closer to home, so to speak. We definitely knew that it was going to have a very significant impact on the morale and the mood of our workers at the hospitals, both hospitals, Mungay Hospital and General Hospital, of course, that was affected in a very significant way.
The Health Ministry held an early morning caucus to chart a response plan of action for members of staff who were impacted. The lab at the General Hospital was closed for the day to help the workers process the loss of their colleague, 40-year-old Kimberly Felix. The management team also journeyed to the Mount Gay Mental Hospital to meet with the team who are mourning the loss of Rosie Roxy Batiste, who died yesterday.
Very significant for us, though, this morning, spending some time at the laboratory where one of our staff members worked. That was extremely painful. I have never experienced such deep hurt as before. This is my first experience with that level of hurt. So we did spend some time with them, and then later in the morning, spent some time with the staff at the Mungay Hospital. The support is not going to end today. It's going to be a more sustained effort, because for some people it takes different time for them to overcome pain and hurt. And so we are going to be here to support them as long as it's necessary.
While focusing on the two facilities where the health employees worked, the support will not be limited in scope.
The health impact is not just from the fraternity and our colleagues that have passed on, but others who witnessed and were part of the accident as well. So the intention is to have everyone be supported socially and psychologically in some way or the other.
When asked about the other persons who were rushed to the hospital following the accident, Dr. Martin said that they were still conducting an analysis of the extent of some of the injuries and that they would present a report when this is available. Reporting for GBN News, I am Odette Campbell.